Today, I'm going to talk about antidepressant medication. Antidepressants are incredibly helpful for a myriad of mental illnesses, but they're predominantly used for depression, anxiety, and post-traumatic stress disorder. These medications will greatly reduce your depression and anxiety symptoms and give you rapid relief when you find the right medication for you. I say the right medication for you because sometimes you can give one person a medication and it works great, but you give it to the next person and it's not helpful at all. This is because everyone metabolizes different medications differently. So that's why. These medications are incredibly helpful for a person who has persistent, severe depression or anxiety, and they're looking for rapid relief. It's not a good choice when you are just starting out with mental health, you've never tried therapy, you haven't learned any coping skills or therapy techniques, because then you don't have a good framework. If you have a good framework, you can avoid antidepressants altogether sometimes because you're able to control your depression and anxiety naturally. But it is important to take antidepressants when they are needed, because if you don't have them, it can be like fighting a house fire with a fire extinguisher when you're using your skills to control severe symptoms. It's just not going to make big enough of an impact like these medicines can do, which will then turn a house fire into a small fire, which you can then put out with an extinguisher, your skills. Oftentimes people say they are afraid of these medicines or they don't want to take them because they heard of a bad experience somebody had, and even that they're afraid of becoming addicted to these medicines. Well, sometimes people do have bad experiences, but you can discontinue them immediately if you have severe side effects. You should definitely give antidepressants a try when you've already given therapy a try and are not seeing a reduction in your depression and anxiety symptoms. You also cannot become addicted to antidepressant medicines. People don't sell these on the streets because there is no high or euphoria associated with them. They simply just correct the neurotransmitter problem inside of our brains and reduce depression and anxiety. Well, there we have it. I hope that this was helpful and informative. If you feel like you need an antidepressant medication, you can simply tell your therapist or primary care physician, and I'm sure they'll be more than happy to assist you in getting one prescribed. Don't lose hope if one doesn't work for you, because like I said earlier, there can be a bunch of different ones that you can try that your body will metabolize, so don't give up. Thank you, and God bless you.